Thank you, Daniel. Thank you so much. It really is so exciting and such an honor and such a pleasure to be here and together, right? Father-daughter duo. It means a lot to us, and to be on this stage where so many inspiring case studies and insights have been shared over the past few days on what's now, what's near, what's next. And it's also been really almost infectious and exciting to be surrounded by so many people who are entrepreneurs, so many people with a strong entrepreneurial spark within themselves. And I love that because I've always felt that entrepreneurship was the way to spark big change. This is the way that we are able to touch many lives. And as I was studying and as I began my professional career, I was kind of concerned when I would look at entrepreneurs, at these people that I would admire, and I was really concerned about how being committed to your mission, to your business, was affecting your home life, your relationships. So as a researcher, I studied a group of award-winning entrepreneurs, and I tried to dig in to understand whether it was possible to have your cake and eat it. Right, to have a successful business and a successful romantic life. And I was shocked by what I found. I was really shocked because 83% of them were not able to have a romantic relationship because of their businesses. That really took me aback. It didn't deter me from my missions. I mean, we've now built a healthcare venture studio, and we work with Fortune 100 and 500 companies on their strategic projects and on business development, and we've had a great run, but we've definitely kept that very present in our minds. And now, about a decade later, and as we've kind of gone through this, I found a study done by Harvard, a group at Harvard, a 90-year-long study that was quite shocking. Found that senior managers and executives experience a mortality penalty of around 3 to 5 years compared to employees lower in their organizational hierarchy. This we wanted to share with you, especially given that so many of us are in leadership roles. So many of us are working towards that and trying to save lives and trying to impact lives. And yet this is the reality that we're dealing with.
And on top of that, you see, there is another group of people who devote most of their time to saving lives. And they're in trouble too. People like me, physicians. In the United States, every day, one physician will commit suicide. Okay? If you're a male physician, you have 40% greater chances of dying by suicide than other male members of your population, of your community. If you're a woman, surprise, surprise, things are even worse. Your risk of ending your own life will be twice as high as the risk of a woman who is not a physician in the population. Okay? And we would think that that shouldn't be happening. Okay? We pay attention to all this literature on determinants of health and all that, we should be doing better. If I change my hat and put on the epidemiologist one, then I have had decades of exposure to studies showing that certain groups of society have shorter lives than others. Okay? One never gets used to those. But from time to time, a big one hits you. And this is one. In 2019, a group of researchers looked at data from 2015 from the 500 largest cities in the United States. And what they discovered was pretty disturbing. Okay? Take Chicago. In that city, a baby born in Englewood, a neighborhood, would live 30 years less than a baby born in Streeterville, just 10 miles away from each other. It takes 20 to 40 minutes to visit each other if they chose to do so. But then the same pattern happened in 55 other cities, and we're not talking about minor cities, New York, San Francisco. DC, 20 to 30 years of difference for babies being born in different parts of the city. This difference is equivalent, okay, to the difference in life expectancy between Monaco and the Central African Republic. Okay, these are the two countries in the world with the longest and the shortest life expectancy. But in this case, it's not only happening within a country, but within the same city. Okay? And this is very concerning. So if we draw a through line from the entrepreneurs, the executives, the physicians, we suspect that the situation is very similar or worse for nurses, by the way. We have also looked at thousands of studies and data from millions of people, and that line is pointing at an upstream factor that seems to be feeding all these common killers: dementia, heart attack, stroke, cancer, suicide, okay? And making the picture worse. And nobody seems to escape from this upstream factor.
Exactly, nobody escapes, and that's kind of what we've been seeing from all our examples, and that's just been fueling our urgency to act on something that we have called the toxic stress load. So the toxic stress load is the buildup of negative physical and psychological changes that result from your ongoing need to respond to challenges. So you can think of it as the baggage, the scars, and the tensions that you are going to be building up and taking through life as you face obstacles. So think, for example, of a business executive who, say, for example, has all their money in a bank that has gone down. A bank.
Familiar.
Sounds familiar. They are likely not sleeping. Their cortisol levels are going way up. They're skipping their physical exercise. They're grabbing food that's really quickly available, which is probably not the best for them. So they're being cognitively impaired. They're fatigued, and this is just going to help, like, just keep fueling that negative cycle and building more negative habits. And this is really what we're concerned about.
Yeah, and it has, the term comes from two phenomena that we have been studying, again, for decades. One of them is called toxic stress, that is our capacity to react to the inevitable challenges that we face through life. Okay? And the other is allostatic load. Okay? We seem to have the ability to look at patterns, and physiologically, by the way, and to try to identify the best scenario that would lead to the optimization of the use of our energy while we are facing and getting ready to react to the challenges. So on the one hand, we have the response to challenges, and the other, we have a proactive ability, okay, to bet on what might be happening. And then on top of this, we are emphasizing something that is very special, and it's our psychological response to the inevitable challenges. So in a nutshell, we are the survivors of the paranoid. Those people in ancient times who were able to notice threats and did something about it. Okay, early enough and effectively enough to survive. And
exactly. So this is a remnant of precisely our evolution, and what we've added on top is that experiential component. But typically, doctors would see patients already with heart attacks, with strokes, missing all of these early signs, and that's really what the toxic stress load is. It's, as we've spoken about many times, it's that like check engine light, or when something isn't fully working, you're able to prevent having to check your car into the shop and have really costly repairs, or totaling your car completely because you're paying attention sooner.
Yeah, and it doesn't matter how privileged you are or how marginalized. We are all facing inevitable challenges in our lives.
Yeah, and what's been very hopeful and exciting for us is that there are some core modifiable sources of TSL. So there are some things that we can do to change this fate, right? And these are some of the most impactful ones. Poor sleep, worries related to money, work, and family, mistrust and loneliness. We've spoken about loneliness. Loneliness kills. It's the equivalent of smoking 15 cigarettes a day, right? And these are things that can be modified.
Yeah. So we have been collecting a lot of data, and signals have been consistent over the years. And they have led us to identify 8 variables. These are the underlying variables that feed the toxic stress load, the TSL. And we have selected them on the basis of their relationship with premature mortality, their frequency, and our ability to do something about them. So let me take an example, self-reported health, right at the top. We just published a book titled Healthy No Matter What, and this is a central piece there. And self-reported health is something that we can generate in response to a simple question, apparently simple question. Is, in general, how would you rate your health? Is it poor, fair, good, very good, or excellent? Over 4,000 studies show that this is incredibly predictive for many things. But then again, in 2022, one article was published with data from more than 700,000 Americans. And the main finding is the following. If you rate your health as poor, you would live 23 years less than somebody who rates their health as excellent. Simple question, takes about 10 seconds to answer it. Mm-hmm. And you see there 7 of the 8 variables in green. And these variables are very closely associated with low levels of TSL. Okay? As you notice there, if you have low TSL, it's practically impossible for you to say that your health is poor or fair. And at the bottom, you see one that appears in pink, which goes in the other direction, and that is work-related stress. If you feel that you have moderate to extreme levels of work-related stress, and you can do it right now, it takes about 5 seconds to judge that, your chances of early death increase. And when we look at all the other cells on the moderate to high TSL level, what happens is that there is a combination almost always of variables feeding each other. Okay, and threatening our longevity. For example, somebody who has work-related distress, okay, would be in a population in which 80% of people would have poor quality sleep. And when these two things come together, poor quality sleep and work-related stress, the rate of cardiovascular mortality triples.
Yeah, and precisely because of these findings, we have made toxic stress load, the TSL, one of our main priorities at our venture studio called Vivencia. So what we've done is we've been trying to create and incubate products that help to target these things and help to manage the impacts of the toxic stress load and collaborate with different organizations and with different people leading the way to increase our health span and our longevity. So one such example is a product we're about to launch called Nudge. And this one focuses precisely on sleep so it's an amino acid-based dietary supplement that nobody can really be allergic to. It's all about the formulation in terms of the timing and the dosage. And essentially, because sleep almost sets you up, it's like a domino effect for what's going to come. If you wake up fatigued, your stress levels, and then you're related to work or family or finances and your ability to really thrive are hampered. So we've really decided to focus and narrow in here, and you take it before you go to sleep, and it improves your sleep efficiency so that you're able to wake up fresh if you got not enough hours of sleep, or if you tend to sleep poorly, or you know you're going to sleep poorly. Another thing that we've done is we've had some really exciting collaborations with organizations. For example, we worked with an insurance company that covers 3 million people across 100,000 companies.
And what we did together was to look at those underlying variables feeding the TSL and use the responses from their members and their employees to figure out what was needed to minimize their impact. And at the end, it was clear that we needed a hybrid approach. On the one hand, a digital platform that is called Wellbeing a la carte. It allows to tailor the responses okay, to the needs of the person, and individually or as part of groups. And the other component, and this is a slice of one of the facilities we built, in which people can go and have support to deal with other issues. You have financial concerns, you get advice, you get loans, you get relief for that. You can have the promotion of a community life. If you are lonely, you meet people and you develop relationships with them. So after a year of launching this project, this insurance company increased the level of the membership base by 25%, and 3 years later, they had doubled it. And what was even more shocking to us was, in a good way, was that more than 90% of people expressed high levels of satisfaction with an insurance company. So we believe, you see, that based on all this data, on all the experiences we have had, that the TSL is an upstream composite risk factor. And this notion of a composite risk factor is very important because it's allowing us to learn from others who have been doing this for a long time. The US Army, for example, okay, has at the core of their operations something called composite risk management. Okay? And what they do is identify the variables that are underlying the risk that are facing the soldiers so they can intervene and prevent unnecessary deaths in the armed forces.
Yeah, and when we consider it as an upstream composite risk factor, that opens the opportunity for all of us here and everybody watching and listening to be able to intervene sooner so that we're able to save lives sooner before it becomes too late. And in these efforts, we've been paying a lot of attention to different diagnostics, monitoring options, and therapies so that we can make a difference. And we were really interested in cortisol in saliva, something to be like, and different options that you can do at home or on the go. And we were really excited by this. And then we went to the innovation lab and we were having a coffee and we just turned around and we found Paradigm, which is precisely doing that. And we were just really excited and grateful to Daniel, to Shauna, and to NextMed for precisely creating these kinds of happy meetings and potential collaborations.
And just like this, we are very excited about many other possibilities for monitoring and diagnosis through breath. We have heard about that, tears, not only saliva, through our skin. Anything that would make people's lives easier in terms of monitoring what's happening so we can take action earlier. There are also many possibilities around pharmacological interventions for this. In 2022, it was great to see how companies started to offer off-label ketamine as a benefit to their employees. Okay? And the idea is also to use a pharmacological measure to reduce, you see, our tendency to be hypervigilant, to be alert, to be anxious, catastrophizing, and at the same time improve productivity. Possibilities are also opening through entheogens. And so it's a very exciting space. And again, what we are trying to do is to tackle things as upstream as possible before they become.
Yeah, and we feel that a lot of these things would benefit from being complemented by digital technologies and solutions to kind of pair with it, or even serve as a treatment in themselves. One of the ones that makes us most excited is the idea of cognitive bias modification. So the name pretty much says it all, but essentially what it is it's an exercise that's relatively simple that helps to change your thought patterns. Rather than, since we are the descendants of the paranoid, rather than who survived, we can break those mental tendencies, right? We can settle down a little bit. So there are very simple exercises that are relatively ambiguous and leave you the opportunity to interpret it as either threatening and stressful or neutral, positive, or welcomed even. And this can be exercises as simple as trying to spot a smiling face amongst many angry or discomforting faces, or finishing a sentence in a way that it can be uplifting rather than negative or terrifying. And
well.
Yeah, we're super excited by these kinds of.
And the bottom line really is that when we consider the TSL as a composite risk factor, it opens many possibilities. It creates the conditions, okay, to look at these common killers and to set in a very different way and to offer diagnostic and therapeutic solutions that can enable us to save more lives earlier. I mean, the key word here is earlier.
Mm-hmm.
Okay.
Yeah. So if you are curious about your TSL, if you're concerned about your TSL, you can use this QR code here that we have on the screen. That is essentially our index, and you can check to see how you're doing and reflect a little bit on the biggest contributors to your TSL right now.
And if you're interested in collaborating, just let us know.
Exactly. Thank you so much.
Thank you very much.
Thank you. Thank you.
So, great job, guys. Thankfully, my TSL is super low this week. I haven't been hypervigilant. My cortisol is probably on the floor. If you were to give sort of the quickest 101, and what's the most elegant and simple approach to lowering these elements for anybody that can do today, without measuring cortisol or other elements, what's the simplest?
Yeah, we actually issued a challenge that has 3 key things that have received a lot of positive feedback, and one of them is to reach out to people that meant a lot to you that you maybe lost touch with and share a fond memory that you have with them, right? The second is to go outside, spend some time in nature, and really immerse yourself in that. And then the third one is to take a mini holiday. Just even if it's an hour, just take it for yourself. And yeah,
Consider it a holiday.
Exactly. Consider it a holiday. Holiday mentality on. All right.
And take a walk on the beach with your shoes off, grounding.
Exactly. And there is plenty of evidence that blue spaces can have a huge impact on the TSL and our lives.
So we're in a blue space.
Yeah.
Awesome.
Exactly.
Thanks so much.
Thank you so much. Thank you.